Good morning. I am Gabe Albornoz, and we are going to go ahead and convene this important meeting of our Health and Human Services Committee. We are all here, which must mean nobody won Powerball last night, unfortunately, but somebody in California did. That would have helped the county's budget situation had somebody did win the Powerball last night, but we are very pleased to be with you in part two of what I shared yesterday is two of my favorite days on the council, certainly as chair of the Health and Human Services Committee, when we have the opportunity to hear from extraordinary leaders in our community who volunteer their time and their talent to be able to advise not just this body, but the county executive as well on incredibly important matters facing our community every day. You are our eyes and ears. You help build bridges in our community. You help ensure that we improve upon the social service delivery system and social safety net that we have. You also help us provide vision and help us be innovative as we tackle some of the very complex challenges before us today. Joining us today is once again Dr. Bridgers, who made some wonderful opening comments yesterday and did a fabulous job answering a lot of important technical questions. So we appreciate you so much, Dr. Bridgers, and your team. And I want to once again thank Ms. Yao for helping to organize, not just logistically, but all of the work that goes into this session, and most importantly, the follow-up after it. So thank you all so much. Just some housekeeping. What we are going to do is hear from three groups at a time. If you are here in person, when I call your organization, please feel free to join us at the table. And please stand by if you are joining us virtually. Good morning. Please also be patient with us because things change, and sometimes we have on the list that somebody will be showing up in person but testifies virtually, or vice versa. But everybody did a fantastic job yesterday, and we will do our best to get you all out of here on time so you can go about your busy days. So we will begin with three boards and commissions. We will begin with our Board of Social Services, followed by our Citizen Review Panel Advisory Group, and then we will have the Commission on Aging. But we will begin with our Board of Social Services. So if you are here for that testimony, please come forward, or if you are virtual, I don't see Brandon here yet, so we will go ahead and skip Board of Social Services, but come back to them. Then we will go ahead and begin with our Citizen Review Panel Advisory Group, and Ms. Stacy McNeely.
Yes, good morning, panel members and others that are in attendance today. First off, I want to thank you for the opportunity to testify in front of you today regarding our priorities for the upcoming fiscal year. So in fiscal year 23, we were looking into some resource family retention and recruitment issues. And in doing so, we reached out to the Montgomery County Resource Parents Association, and we sent them a survey and got some really excellent feedback from them. Part of reviewing the results from that survey led us to narrow our focus this year to two very specific topics regarding both recruitment of new resource foster parents and retention of existing resource foster parents. So in the area of recruitment of new resource foster parents, we're looking into how do we target untapped communities and what kind of strategies could we pursue, new and different strategies for emergency placement homes. And so the members of the panel have been putting together a list of personal connections and other groups that they wanted to suggest be considered to the Child Welfare Services Agency representatives that we work with. They met with the agency for their reaction and prioritization and got feedback. And now we're absorbing that feedback and discussing next steps as we go into fiscal year 24. Regarding the retention of resource foster parents, one of the things that we chose to focus on based upon some of the feedback we got is helping resource families deal with grief and loss at reunification. As we all know, reunification of families is always a goal when it comes to child welfare services, but we wanted to acknowledge the difficulty that can be for resource parents and resource families as they welcome these children into their homes and then have to deal with that grief when they're reunified with their families. So we've been looking into and collecting a list of a lot of different materials presented in different formats, and we're reviewing those with the Child Welfare Services Agency, and we are looking to narrow down and present a recommendation of information and learning and trainings from different styles, because people learn in different formats, and also especially given special consideration to things from different languages, as we have resource families who speak multiple languages. So those are the two areas that we are focused in the upcoming year. And then additionally, we meet monthly with a representative from Child Welfare Services and review the agency data on assessments and placements, and as always, get general updates on agency operational issues, so that we make sure that there's not other topics which come up over the course of the year which maybe should be reprioritized as a new focus. Thank you very much.
Thank you very much. And so again, we will hear from two more groups, and then we will ask questions of everybody who just presented. So please stay on the line. Ms. McNeely will get back to you with questions in a couple of minutes. Next, we will hear from Mr. David Engel from the Commission on Aging, who is here in person.
Good morning, Committee Chair Albornoz, Councilmember Lukey, and Councilmember Sales, and Dr. Bridgers. On behalf of the Commission on Aging, we want to express our gratitude for the unwavering support provided by the County Council and the Department of Health and Human Services in the past. Your steadfast commitment to our mission has enabled us to better serve the aging population. Based on the testimony that I heard yesterday, I thought it would be helpful to let you know that as of October 10th, the Commission on Aging has 7 new commissioners that have been appointed, and we are a fully staffed commission. Over the years, your support has empowered us to make significant strides in enhancing the quality of life of our senior residents. Last year, the Commission on Aging worked with the Area Agency on Aging and Aging and Disability Services to assist with identifying programs to receive ARPA funding. One of those is a program we have been advocating to implement for a number of years. It's Access Hears. It's the first county-sponsored hearing health intervention program. As we continue to strive for the betterment of our elderly community members, we're committed to making Montgomery County a place where aging is not just a phase of life, but a celebration for the wisdom and experiences our seniors bring to our society. Thank you to Councilmember Sales for including the Commission on Aging in the Senior Citizens Day proclamation recently. The Commission on Aging is laser focused this year on presenting its top 2 budget priorities for the county fiscal year 2025. These priorities are not only crucial to the well-being of our aging population, but also have the potential to benefit our other boards, committees, and commissions. We believe that by focusing on these priorities, we can further strengthen our commitment to serving all residents regardless of their age. Number 1, hire a permanent marketing and outreach staff person in the Department of Aging and Disability Services, including coordinating the Commission on Aging's innovative volunteer ambassador and library liaison programs. There is a glaring unmet need affecting every community in the county. Regardless of income or the language spoken, residents are unaware of the vast array of services and programs available for older adults. We hear this same message from our community partners, such as the American Muslim Senior Society, where the message was repeated as a #1 concern in their very recent 2023 Mental Health Public Forum. We heard this message repeatedly from you and our fellow BCCs and minority health programs. Latino Health Initiative stated yesterday that the health worker training program needs a communications plan. Councilmember Lutke mentioned that the county needs a cannabis myth-busting PR campaign. The Councilmember Albornoz brought up yesterday that paid advertising missed last year's budget. A staff person in the department can help make this implementation come true. The Mental Health Advisory Committee noted that the need for a strategic plan. Funding this position will help narrow the critical communications gap to older adults. It will help ensure that our older residents receive necessary information about vaccination programs, dental services, in-home care, respite services, whom to call when they think they've been scammed, how to reach long-term care ombudsman, learn about the new home repair programs to stay safe as they age in place, and how to obtain other life-sustaining services provided by A&D, such as adult protective services. This position should provide outreach to the county's many diverse communities, support a library liaison program to ensure all public libraries have an older adult section with materials of interest to older adults. I've distributed to you today a packet of information that's hot off the press called Life Transitions as We Age. That's the kind of thing we want to get into the public libraries. Coordinate a county-wide ambassador program, promote the senior nutrition program, support the county's minority health programs, and more. The Public Information Office now staffs 9 departments, but notably not Aging and Disability Services or HHS. I know this is a big job, and of course a team would make sense, but now there is no one, nobody, so let's start with a team of 1 and work forward from there. Number 2, hire a full-time implementation manager to ensure the county executives' mandated home and community-based services workforce task force recommendations are fully recognized and carried out. Following the Commission on Aging's 2022 public forum entitled In-Home Care, We Can Do Better, the county executives established a task force to identify the issues associated with the scarcity of workers to provide in-home care and to make recommendations on how to increase the supply of those workers. There is a growing crisis in Montgomery County of dwindling direct service professionals to meet the needs of our rapidly aging and increasingly diverse population. Access to high-quality home and community-based care is a health care equity issue that disproportionately affects marginalized groups. We heard this yesterday specifically from the Asian American Health Initiative. There's a shortage in the workplace of direct service professionals to provide these services. The prevalence of low wages, difficult working conditions, lack of training, and limited opportunities for advancement have contributed to a national and local shortage of direct service professionals. Funding this position of implementation manager enables the county to begin to address the significant and vexing public policy issue affecting large number of older adults and their families. It will provide a single point of contact to plan, coordinate, and oversee the implementation of the task force's many pragmatic and innovative recommendations that are designed to address the shortage of direct service professionals by improving recruitment, training, and retention. I think there's about 25 recommendations in the report. You may have been briefed on those earlier this year. We believe that by investing in these budget priorities, we're taking significant steps towards making Montgomery County a community for a lifetime. Please consider these priorities with the knowledge that their positive impact will resonate far beyond the aging community alone. We look forward to your collaboration to make our shared vision a reality, and we are truly honored to have Councilmember Albornoz speak at our October 26th Summit on Aging, and we hope that we have participation from the full County Council to help build our new agenda for a community for a lifetime as a result of the summit. Thank you.
Thank you very much, Mr. Engel. Is Brandon, I know he was having technology issues. Brandon, were you able to join us? I believe his video wasn't working. Can we, Brandon, are you there? We can do audio, Brandon. You don't need your video.
Okay, can you hear me?
Lightly. If you could speak up just a little bit.
Okay, hang on one second. Sure. Can you hear me now?
Yes, that's a little better.
Excellent, excellent. Yes, I think I got kicked out of the video portion, but that's okay. I'm here. So I'm Brandon Bragg. I'm the chair of the Montgomery County Board of Social Services. We provide advisory oversight to the social services programs in Montgomery County that are funded by the Maryland Department of Health and Human Services. The program includes state-funded income support programs, emergency stabilization programs, state-mandated child protective services, foster care, state-mandated adult protective services, and home care services. I'm delighted to be in front of you to discuss the priorities of the Board of Social Services that we've set for the 23-24 calendar year. As the Board of Social Services, it is our responsibility to ensure the residents of Montgomery County who have the greatest challenges and least resources receive the social services that they need. As we continue to emerge in this post-COVID pandemic world, we're still facing extensive economic and social inequalities, both across the state and right here in Montgomery County. During the first half of 2023, the Board of Social Services focused primarily on establishing and expanding our collaborative efforts with other boards, commissions, and committees, and hopes to identify areas where the board can focus our efforts within the community and through HHS. Prior to the summer break, we had 2 vacancies, which were actively being recruited. After the summer break, we lost 3 additional board members. We hope to refill those remaining vacancies soon, and so we can properly serve the residents of Montgomery County. Our main priorities for the new year include increasing access to mental and behavior health. We feel like our seniors, our youth, and low-income residents face a disproportionate level of barriers to existing mental and behavior health services. By increasing access to preventive care for our seniors, youth, and low-income residents, we can reduce those barriers between the demand and treatment in mental health and behavioral health care. We encourage agencies within HHS to work together to make sure resources and information are available to mitigate mental health crisis incidents. This will improve the affordability of mental health treatment and access to care. The board will continue to support efforts to expand access to behavioral health providers, invest in prevention, and increase the available of mental health services throughout Montgomery County. Our second goal is to continue prioritization and support for greater trauma-informed education. For several years, we made this a priority with the knowledge that trauma-informed practice is central to social services. This practice continues to be fundamental to social services, a need that continues to be magnified in this post-COVID world that we are operating in now. The board will continue to work together on this priority of raising awareness to enhance and expand trauma-informed education throughout this great county. We also plan to continue to advocate and encourage community engagement. On behalf of the Board of Social Services, I would like to express how grateful we are for the ongoing work and support of the Montgomery County Council. You've made a significant positive impact on the lives of our most vulnerable residents. It's with your support that the social services programs available in our county gone beyond the basic needs of residents and expanded to supporting independence, self-sufficiency, in order to create a better future for everyone. Thank you for your commitment to continue to serve the residents of Montgomery County while making it a priority to provide the most vulnerable with support they need to be successful. The Montgomery County Board of Social Services greatly appreciates the partnership we have with all the members of this esteemed committee. Thank you.
Thank you so much, Mr. Bragg. Appreciate you. Love that you all are collaborating with other boards and commissions to meet, which I think is great. Mr. Engel, thanks for coming yesterday and taking copious notes, clearly. I think the cross-collaboration, as we all see, creating a time and place for these 2 days for the boards to be able to hear about each other's work, I think is really helpful. And maybe as a follow-up, Ms. Yao and Dr. Bridgers, we can think of how to more intentionally connect them in other ways as well. Because as Mr. Bragg was talking about their incredible work, our Victim Services Board came to mind, and a lot of the crossover work that they were talking about there, the need for trauma-informed care is obviously very real in that space. So I just had a couple of comments, and then I will yield to colleagues. So Ms. McNeely, I wanted to make you aware of an organization that was recently brought to my attention that I think may be of interest to you all, and encourage you to connect with them. The organization is called Connect Our Kids, and their website is connectourkids.org. And the founder of this organization was a classmate of mine in the Presidential Leadership Scholars Program. She has developed a software and a technology tool that helps connect foster children with their families. And obviously there's a lot more that goes into it. She just has created the technology solution, but still clearly there needs to be case management, social work, all of the other wraparound support. But this software that she's created is really actually extraordinary. It was recently featured in a national technology conference. She was the keynote speaker. And I am following up with her to meet to learn more about this particular tool. She has a contract in place in Northern Virginia, and she's trying to bring that same technology here to Montgomery County. What might be good, because I don't believe we've set the meeting up yet, is for me to invite you or a member of the organization to come with me virtually to meet with her. If you're interested in that, I'd love to follow up. But if you could check it out in advance and let me know your feedback and thoughts, that would be very helpful. Again, it's called connectourkids.org. So
Yes, absolutely. And I think our liaison with the Child Welfare Agency, Lisa Merkin, would be an excellent person to include as well.
Awesome.
Because she's always trying to stay informed on the latest solutions that can help in any way with our children.
Awesome. Thank you so much. And to our commission, I'm very much looking forward to the Summit on Aging. We haven't had a summit in 7 years, and so it's time to bring the band back together again. The process and the journey that goes into the summit is almost as important as the actual summit itself, but the follow-up is the most important. And so I think what we need to do also is update the asset maps that were developed during the last summits to really track where we are as a community. We received the moniker of an age-friendly community, and that was critical, and we need to keep that going, but we know that the needs have expanded since then, particularly because of COVID. So, but I like the idea of a permanent full-time liaison to follow up on some of the recommendations of the in-home care. I think that's clearly we need more staff support in this space, and I think that's something we'll have to take a look at as we go through the budget process. But I will now yield to colleagues to ask their question. Councilmember Lukey.
Thank you. And I think David knows he was speaking all the right words to talk to me today, saying all the right things. And clearly you took copious notes yesterday. But in hearing Councilmember Albornoz remind everyone that following up to the summit is most important, and certainly you have, as your statement indicated, a compliance-minded focus. And I agree. I think this is not just a thing that is unique to the Department of Aging and Disability. It is more of a cross-county government thing where we need to do a better job of making sure we know the mission, we stay with the mission, and we make sure the mission's getting done. And that compliance-minded focus needs to be top of mind. Have you, as a group, talked through ways to engage the faith-based communities to help spread the missions of the Department of Aging and Disability to do a connect that's deeper out into the community?
Well, we continually talk about what areas we can expand our focus to get feedback and input on where there are gaps of services. So recently, at our most recent commission meeting, we had Kate Chance from the Office of Community Partnerships come into our meeting, and we're constantly trying to build those partnerships with these groups. So we do have, you know, not an affiliation specifically, but
Right.
with the American Senior Muslim Society, as I mentioned,
Right.
and all the minority health programs as well. So getting into the faith-based organizations, I mean, one issue there is housing, and we know that they're making an initiative to
Yeah.
work on housing, and that's another priority of the Commission on Aging and many other committees, commissions, and boards that we heard yesterday. Housing is an issue. So yes, we are just looking for anybody that we are missing out from the outreach, which is why we need the marketing and outreach
Right.
person to help us fill those gaps.
Right, because you as volunteers, I mean, you can come up with the ideas, but there's got to be someone there who can take them all and then execute them. And
Correct.
I appreciate the work that you all do. You're a very active body and a very engaged body, and I just want to make sure that the work you are doing is getting to someone who can deliver results for you. And the next question is for Ms. McNeely. You were talking about the reunification process and sort of the emotional things that go on with that reunification process. And I happened to be having a conversation with someone last night more about the state level and that issue. What percentage of the children in foster care in Montgomery County do end up being reunified? Do you know?
I don't have the latest numbers off the top of my head. I can certainly get back to you with that information. That is always the primary goal.
Right.
So it is a pretty high percentage, because it's definitely the goal is to keep those families together and to work through whatever issue necessitated the separation in the first place. But I can get back to you with that information.
Thank you. And do you know how long, or this might be not an answer for today, but an answer you can give later, but in discussing your work and figuring out the time of stay within the foster care system and the age of the children when they are reunified, any information that you could get back to us with on that would be really helpful.
Yeah, we have, and in the data that we review monthly, there is information on the average, the length of stay. I don't believe that there's information in there currently, or at least not with what was shared with the panel, regarding average age. But I can follow up with our liaison and see if they have that information readily available with their new system. They certainly have greater capabilities for reporting data, so I can collect it all and send it along.
Thank you. That would be great. Thanks so much. And the next question is for Brandon, and I know I sit on the Board of Social Services as well. I know you were focusing on the collaborative work with other boards, committees, and commissions to help further the Board of Social Services mission. Do you have a plan moving forward for this year, for the upcoming year, since we've just had our first meeting of the year since the summer break, for what other boards, committees, and commissions we will invite to our meetings to discuss the work of the social services?
Yes. Can you hear me, Councilor?
A little.
Can you hear me? Okay, sorry. Is this better?
Yes, thank you so much.
Hang on. Okay, yes. Yes, we do. We've established an outreach committee, which will help us carry out that mandate to stay true to the mission, as you said before, and make sure it happens. I've also reached out to the, I've participated in, I should say, earlier this year in the Disability Committee and also the Aging Commission with one of my peers who just spoke earlier. So I look forward to continuing to do that and continuing to reach out to other boards that are doing great work as well, so we can collaborate and synergize and hopefully share the resources and the knowledge and make sure that we make a huge impact for the residents of Montgomery County.
Thank you. I think just, speaking for myself, it would be helpful if we invited the chairs of some of the other BCCs of interest to come and attend our meetings and provide an overview and update about their own work to us as a body. I think that would be really useful.
Yes, that sounds like a great idea. I'd be happy to do that and looking forward to implement that in the near future.
All right. Thank you so much.
Thank you. Councilmember Sales.
Thank you, Councilmember Lukey. And thank you again to all of our panelists here today. I'm just going to jump right into the questions with starting with our chair from the Board of Social Services, Mr. Bragg. Just following up on what Councilmember Lukey mentioned about the relationships with other boards, committees, and commissions. How are you increasing access to preventative care for seniors, youth, low-income residents, and assessing the effectiveness of those efforts? If you can elaborate on any of that.
Well, I can tell you that's certainly an area of focus for us, and that would be part of our outreach effort, hence the outreach committee that we are putting together now. And I think the continued collaboration between other boards and getting best practices and ideas implemented will help us to carry that out.
Okay. And so how do you evaluate those outreach efforts with how you're raising awareness to enhance and expand the trauma-informed education that throughout the county?
I think part of that would be, interfacing with HHS, with some of the folks that are actually, setting the policy on that. And the other part would be community engagement. Hopefully we can get out into the community and get more feedback from residents to assess, whether or not the impact is, or whether or not we're making an impact, or whether or not the services that they're getting are adequate and making a difference.
But how are you getting that feedback from the community?
Well, asking for that feedback. We're looking to record our meetings and invite the community to participate in our meetings as well. And I hope that we can, get more folks at least to participate in our meetings in the coming months now that the summer break is over.
So I guess Councilmember Lukey can work with us to keep us updated on upcoming opportunities for the community to participate in these meetings so that we can help disseminate that information, because I didn't know that there were meetings that the public could come to with the Board of Social Services, and you cover so many different areas, so it would be helpful to learn more about those outreach and engagement efforts. So thank you. Ms. McNeely, if you're still here.
Yep.
All right, thank you. What is the current model of compensation for foster parents, and how are we determining the compensation provided is being used for the children in their care?
That's a very good question. I honestly am not certain of the answer to that question. I know that there are guidelines both followed from the county and at the state level that are necessary to follow. That has not been a particular area of focus when we reviewed the feedback from the Foster Parents Association. There was some discussion of child care, which leads into, the cost of child care, which leads into the compensation. But it wasn't one of the highest items that we chose to focus on. So I can reach out to our liaison with the agency and get you more detailed information for that. But I don't want to speculate as it's not something we previously focused on in detail before.
Yeah, that's feedback from the foster parents, but what feedback are we getting back from the actual foster children who are going from home to home to ensure that these resources are being used for their care?
That's a very good question, and we will take that back to the Child Welfare Services Agency. I know that the caseworkers within the agency do an excellent job of working with the children specifically and keeping those lines of communication open. But I don't know whether the topic of the compensation and the use of that compensation is something covered, and I can reach out and ask about that.
Yeah, it would be good to see how the actual children are being impacted by those resources. Do we know how many foster parents we're losing that have gone through a difficult reunification process?
There is data that we gather regarding the number of resource homes that we lose from month to month. There isn't necessarily specific data, at least not that I'm aware of, on a monthly basis regarding the exact reason why that home was lost. One of the very positive reasons why we often lose resource homes is because a lot of our resource parents, if reunification ends up not being possible, do choose to adopt. So if we've had some folks who adopt and then essentially don't have the room anymore to take on additional foster children. So I can look to see if we can get more detailed information as to the specifics of why the different homes are lost. But I'm not sure if the county is capturing that at this time, or at least not with what's shared with us.
Okay, and how many foster parents do we currently have?
I believe the number of homes, I should have brought this month's data. I'm so sorry. I don't want to give you inaccurate information, but I can share you the latest data that we got from our meeting this past week, and it has that information in it.
And is there a need for more foster parents, or?
Yeah, there's always a need for more, and there's a number of reasons for that. Number one, we always want to make sure that not only are we able to place a child, but we're able to place them in an most ideal situation. So close to where their original family lives, close to the school that they're used to going to, somebody who's, fluent in the language that they're comfortable speaking. So that's why we always put a great deal of emphasis on recruiting new resource homes, because we want to make sure that not only do we have a home available and a spot available, but that it's the right situation for the child to make this process and make it as easy on the child as possible.
Okay. Thank you. And one last questions for Mr. Engel. Thank you so much for being here, sir. And thank you for coming to our proclamation as well. Wanted to find out, I know we've been talking about the marketing and outreach position. Do we know how many more older adults we can reach, or that are unable to access the programs and services through the Office of Aging because of the lack of having this coordinator in place?
Well, I can say that social isolation, loneliness are problems within non-English speaking communities, and so that those communities can be targeted. I don't really have any statistics on the number. We have 175,000 residents that are 65 and older, give or take a few, and that is continuing to grow. And we know that we have a large immigrant population that's ever increasing. So we know that there is a large population that needs to be reached. And we can take a look at maybe the computer distribution programs and see how much inventory is not being given out, and what the utilization of that is. We just heard the other day we're getting 65,000 more computers to distribute to the community.
Oh, good.
So those programs we could take a look at and identify, what the utilization of those are.
Okay.
To see who's not being reached by programs.
Okay.
And we also know that there is, waiting lists. So there are people who want to get services that can't get services. So we can look at those waiting lists as well.
Okay, and if my last question is just about the members of the Home and Community-Based Services Task Force that you're working in collaboration with. How is that working out, the recommendations that?
Well, so there was a finite period that the county executive gave this task force to work on that project. And so the members of the task force were Dr. Patrice McGee, Cynthia Grissom from Workforce Montgomery, Asha Hamilton, I believe, yes, from Area Agency on Aging, and Barbara Selter from the Commission on Aging. So those were the prime leadership team for that. And the report has been published earlier this year, and the recommendations are sitting. So therefore, the need to have someone push those recommendations forward.
All right, thank you so much.
Thank you. Great questions. I think one thought occurred to me as we were going through this. It might be helpful to, if there are like technical questions with data and that sort of a thing, to make sure we follow up with the staff liaison to the boards and commissions from HHS, and maybe even in advance. That way we've got that information at our fingertips as we go through. Appreciate all of the comments from boards and commission members, which has been incredibly helpful. Thank you all very much. Next, we will hear from our next three organizations. We will hear from the Commission on Child Care, the Commission on Children and Youth, and the Commission on Juvenile Justice. And we will begin with the Commission on Child Care, and I believe Ms. Chair Phillips is joining us virtually.
Good morning. How are you all?
Good, thanks. Great to see you.
Great to see you as well. Thank you so much for this opportunity. I just wanted to share with you a little bit about the vision of the Commission of Child Care is to help access high quality, affordable child care to all Montgomery County families. And our mission is to advise the county executive and county council on the development of government policies, programs, and services that enhance community support for high quality, affordable, and accessible child care. The membership of the commission members includes parents, center and family child care providers, representatives from the business community, general public, and government agencies with interest in child care. Right now, we are not running at full capacity. We haven't had an opportunity to recruit new members for almost 2 years. And as you know, the county council named the Children's Opportunity Alliance the early childhood education coordinating entity for the county. And we have indeed met with COA. They provided a general presentation at our March 23 meeting, and we're awaiting the release of their strategic plan so we can give their priorities and consider some areas where we can further engage. For fiscal year 24, the Commission on Child Care top priorities are to develop recommendations on the Early Care and Education Initiative Action Plan FY 24 through 27 in an effort to support the county's child care system with a specific focus on equity. And our second priority is focus on the sustainability of the early care and education workforce by providing recommendations and hosting a collaborative event on ways to attract and retain professionals to commit to early childhood education as a long-term career option. So overall, that is what we are working on for this year. And I appreciate the opportunity to connect with you all, and I am available if you have any questions. Thank you.
Thank you so much. We will get back to questions in just a moment, but next we will hear from our Commission on Children and Youth, and Ms. LaTanya Johnson. Good morning.
Good morning, everybody. I'm sorry. Traffic was a bear this morning. So the Commission on Children and Youth this year, we are focusing on LGBTQIA youth and career readiness this year. So on the LGBTQIA youth, this topic was chosen at our June retreat, and it was chosen because the Commission has not focused on that particular demographic of youth. And in 2021, 2022, we also focused on youth unemployment. And so they wanted to definitely re-explore career readiness and build upon that topic. The LGBTQIA subcommittee, we just met yesterday. Our meetings are the second Wednesday of the month. And we were lucky to have two speakers from MCPS. One was a vice principal at Blair High School, and her name is Adriana Burgos Ojeda. And then we had Elizabeth Furman speak last night, who is also an MCPS and is an emergent multilingual specialist to the LGBTQIA, because they also deal with gender sexuality alliance as well, and they are big supporters of that particular subgroup. And the subcommittee will also be focusing on gender identity of LGBTQIA youth, housing insecurity, and the mental health component of that subgroup. For career readiness, our subcommittee is looking to explore youth entrepreneurship and how the county can maybe develop more resources around that topic, as well as they're scheduling to have a person from the Department of Corrections speak to youth career readiness and what youth can do to be ready once released from incarceration. And we're hoping to maybe partner with the Commission on Juvenile Justice to maybe talk to them as well and provide some feedback. So that subcommittee will be reaching out to that commission in regards to that topic. And then last year, the commission, we had our full 7 youth last year, and our annual report was just voted on and adopted, so you all will be receiving that shortly. And we had our first ever youth vice chair of the commission last year, Mr. Rishi Nixon, who worked alongside of me. And he was on Council Member Sales Youth Group as well, so I'm very excited about that. And also Sammy Saeed was on our youth commission last year, who's now on the Board of Education representative. So last year we focused on equal education, and we also focused on safety amongst youth. And so what we found was that it is very expensive for commissions and boards to access Montgomery County public data. The costs are very excessive. So in our report, there were recommendations to make that cost, it should be actually no cost to us to be able to access that data, because we need that data, especially for a topic like equal education, to provide more robust information. So it was very expensive for us to access that information. So due to cost, we didn't have access to that. Also, it focused on emergent EML students, which is the emergent multilingual learners. And so there's recommendations around that as well, as far as the mental health component of EML students and how that plays into the equal education component, because they're new, that language barrier, and how there may be more resources, again, geared towards that topic. And then on safety amongst youth, it was definitely focused on like more of the fentanyl related incidents that happened last year within the school system, and students felt that there was a lack of transparency that came out of our youth roundtable that we had last March, that there was a lack of transparency from the school system or the county about what where students could go if they were uncomfortable, to have like a safe space to kind of maybe talk about these particular issues without feeling like they're kind of snitching on their peers. They felt that students should have more resources if they are experiencing substance abuse, to have more support versus disciplinary actions around that, around students, making sure that the parents had more support, the students had more support, and that they shouldn't be criminalized around that topic. And then also some of the maybe monitoring of the bathrooms at school and how it made students feel, they felt uncomfortable around that as well. So those were some of the things that we've been very busy. Those were a lot of the topics that came out of last year. And I spoke about what we're doing this year, and we're just getting off the ground with that. And some of our appointees will be starting next month. So we're a little, behind on that piece. But that's what the Commission on Children and Youth is doing this year.
Thank you so much. We will follow up with questions in just a minute, but
Yes.
we will hear one more presentation in this panel from our Commission on Juvenile Justice.
Hey, good morning, everybody.
If you could move your microphone a little closer to you. There you go. Perfect.
How's this?
That's perfect.
All right,
Thank
good
you.
morning, everybody. My name is Kevin Redden. I'm Chair of the Commission on Juvenile Justice. I want to thank you all for having us here today. This year, the Commission has a few priorities, one of which is new and we are really excited about, and I'm going to save that one for last. So, over the past few years, we have really engaged pretty heavily at the state and local level on legislation that affects juvenile justice in Montgomery County and in some instances the state at large. And we're going to continue to do that this year. An example of that was the YES Act, which was introduced by Delegate Crutchfield last year in the General Assembly. And although we haven't discussed it, we will likely take a position on that as well, and several other bills as they get introduced. The Commission is also going to stay informed on school-to-prison pipeline, which, and part of that will be to share and analyze publicly available data regarding exclusionary discipline, school board arrests, school-based arrests, the CEO program, and restorative justice in MCPS. And to that extent, I know my colleague mentioned collaborating with us on issues of children and youth, and we would welcome that collaboration and are happy to help in any way that we can. And our final budget priority is something that we are really excited about, and is something that just recently kind of came to fruition. And it is the idea of having a juvenile justice center based off of the Family Justice Center that has been a success in Montgomery County. And to that end, the Commission has established an ad hoc committee chaired by Carlotta Woodward, who is the chief of the Juvenile Division in the State's Attorney's Office, and Captain Jordan Statinsky. Judge Smith and Judge Dumais are also members of this ad hoc committee, and they came to one of our meetings, I believe several months ago, and discussed the need for this, and this was essentially the genesis of this idea. So the ad hoc committee is going to explore and analyze options for the establishment of a youth center to better meet the needs of at-risk youth through a centralized and coordinated approach. And I think the idea of this, and this is very abstract, just got off the ground very recently, but the idea would be to have a kind of holistic center that could be preventative, that could be a place for at-risk youth to go and maybe seek certain programs, certain resources that might not otherwise be available. And what that looks like is something that we're going to work on and hopefully present to you all in the coming months. So, thank you.
Thank you. This is a great panel. Just as a follow-up to that point, I encourage you to reach out to the Collaboration Council and Elijah Wheeler. They actually launched a similar effort on a smaller scale several years ago and had to, like so many things, hit the pause button because of COVID. But the vision was very similar to what you've described. And I have not had an opportunity to check in on the status of that particular initiative, but there was actually some state funding provided as a resource. So that I think would be really terrific. And another thing that struck me, and this is more of an administrative opportunity, but Ms. Yao, when we conduct our state legislative briefings, if a board or commission does take a position on an issue, it would be helpful for the council to know that and be included in the notes. And so maybe we can follow up with Melanie and her team to make sure there's a connection, because that would really be helpful. With regards to we're having a joint committee session on November 9th with the Education and Culture Committee to get an update on COA. And so we will hear more about the strategic plan and where that work is going, and we'll have a chance to follow up on all of that. So I just wanted to provide that as a reminder to colleagues that's coming up. With regards to youth employment, which I'm so happy you all are taking that up, and career readiness in particular, there are so many more entrepreneurial opportunities that none of us could have ever imagined when all of the folks in this dais and in the audience were teenagers. There are just endless possibilities now through the advent of social media to become an influencer, or and now that we've changed rules at the collegiate athletic level, young people are in a better position now through NIL to be able to monetize in a responsible and appropriate manner the marketing of themselves. And it just strikes me that we're not really catching up to that. And we still have, as we should, the traditional paths that we encourage our young people to follow, starting with a post-secondary education, as we know is so important, or learning a trade, which is also critically important. I know MCPS, and I'm on the Education and Culture Committee, and Councilmember Fanny Gonzalez and Jawando had a joint session with MCPS on workforce readiness. And there were some follow-up from that, and so I'd encourage you all, and we can provide the staff notes from those particular sessions, but there was some follow-up that I think you all will find interesting and may help guide some of your work in that space. And the other thing that we've been talking about for quite some time is how do we take Summer Rise to scale? It is a fantastic program that is benefiting thousands of young people, but it's 4 weeks, and I think it just scratches the surface as compared to what the District of Columbia is doing now for generations in youth workforce summer readiness opportunities. And I'm channeling Councilmember Rice here, but he was a passionate advocate in this space, and we were able to get a lot off the ground, but there's more we need to do. So I'm glad you all have taken that up. And then I want to thank CCC for your continued commitment and work, especially as we go through this transition, and really appreciate your continued leadership and support. Early childhood and education remains a critical issue for so many families, and there is so much more that we're going to need to do in this space to address the growing needs of families in our community. With that, I will yield to colleagues. We'll start with Councilmember Sales this time, if that's okay. And then we will go to Councilmember Lutke. Councilmember Sales.
All right. Thank you so much, Mr. Chairman. So I will pick up where you left off with our Commission on Juvenile Justice. Thank you, Mr. Redden, for being here. Chairman Albornoz just mentioned partnering with the Collaboration Council Ms. Johnson mentioned her work with formerly incarcerated youth. How are you staying informed about actions and data relating to the school to prison pipeline in our county?
Yeah, and it's a great question. I think it's more inherent in our membership because we have agency members, including MCPD, the State's Attorney's Office, the Public Defender's Office. Those statistics and current trends are routinely discussed at our meetings. And, we try to stay on top of data as it gets published, and we will continue to do so.
So are there any recommendations based on that data? You see that there's an increase in the school to prison pipeline, a decrease. Are there any recommendations around that data on how to decrease those numbers or any analysis done around those numbers?
At this time, I do not have a recommendation for you, but that is something that we're going to assess over the next year, and hopefully at this meeting next year, I'll be able to give you a more solid answer on that.
Sounds good. Thank you so much.
Of course.
And Ms. Johnson, thank you so much for being here. And it looks like we are, training and shaping future leaders in our community from this body. So very proud that our county has a commission dedicated to our children and our youth. And just wanted to know more about the feedback you're receiving from the roundtables with our students. Can you tell us a bit more about what you've done with the feedback you've received and how you're helping to address those concerns, or how we can help you address those concerns, and any support we can provide with invitations for speakers or otherwise?
So thank you, Councilmember Sells. The Youth Roundtable that's held in March is usually around the topics that we're exploring in the current year. And so we're getting feedback from the youth to definitely put into our annual report that we provide. The recommendations, the youth feedback is also considered within the recommendation component. So when you all receive our annual report, you will be able to have more detail to that piece from last year. As far as speakers, our liaison, Dr. Tyson, is very, very helpful with reaching out to you guys and inviting you to speak. And so last year in March, Mr. Albanars, he was there, and Brenda Wolf was present from Board of Education. I want to say Will Jawanda, I believe, was there as well. So she does an amazing job with reaching out to you guys to have you guys be able to participate if your schedule allows. So thank you so much for that support. As far as I think the biggest piece that you'll find in our annual report is around the cost of data, and that our budget, we don't have a budget that will help us to access and pay for that level of data. So I think that was the biggest component from our recommendation. And as far as the youth, they really did zero in on that safety component. And as I spoke to earlier, the feedback that I gave around the transparency within the school system to the youth, knowing who youth can go to without penalization to be able to discuss that level of substance abuse was really a big concern for them. And also the punishments or around youth that are experiencing the substance use. So they were really concerned about that and wanted to know more information about what those processes are from the county, from a school system perspective.
Okay, thank you. I know that you mentioned that the youth LGBTQIA issues are going to be your top priority in the upcoming year. Are you collaborating with any groups?
So currently, our subcommittee chair has scheduled Evan Glass to come speak to us in December around that topic. So they're on the move with that, and they do have a list of advocacy groups that they are reaching out to come speak. I don't have that list in front of me to tell you all the ones, but I know as of the end of 2023, Councilmember Glass will be our speaker.
Very good. And then hopefully you have been in contact with our Office of Workforce Development.
Yes, we plan, that's on the list for the Work Readiness Subcommittee. So in 2021, 2022, we did have a workforce development person come speak. At that time, we were all in COVID, so they were still working remote. So if you all have any contacts to that piece that you can share with the commission,
Definitely.
of someone that we can reach out to schedule them, that would be so helpful. Because it was a little difficult for us to find someone even during COVID. So I'm not sure what their makeup is now. So if anybody has any contacts that you can give to us.
I think Mr. Featherstone, the director, and also Ms. Irina LaGrange from MCPS, who works with all of the small businesses, career readiness programs with MCPS would be two good contacts.
And I'm sorry, can you tell me the director's last name again?
LaGrange, Irina LaGrange.
Okay.
And Anthony Featherstone.
Thank you.
Okay, thank you.
Thank you
and
so
then a question for Ms. Phillips. Thank you again for being here. Is she still virtual?
I am.
Oh, there you are. Okay. I just wanted to, I know we're going to be meeting with others in the early care and education space. Are you finding that students are unable to access early care and education resources because of lack of staff or seats or?
Yeah, we have actually our September meeting. We had a really lively discussion regarding the things that are, excuse me, slowing down enrollment in the child care community. And the major concern right now is staff, specifically adequately trained staff, and those staff who really are ready to make a commitment to early childhood education and or commitment to education in general. So we have found that it is difficult to open some classrooms and staff some of the centers to capacity because there are a number of staffing concerns, shortages at this point.
And how are you working with MCPS, Montgomery College? I know they have programs to train early childhood educators. Starting with. Mm-hmm.
Yeah, we so as you mentioned, those programs have they have apprenticeship programs. They have a lot of training capacity that's happening. However, when it comes to, in the discussion that we had in September, when it comes to Montgomery County high school students, sometimes the issue is transportation to the child care center. Certainly the centers can utilize the skill set of those students after school, and some of those who are seniors who have more hours available at the end of their high school time. So, but getting them transported to the locations is often a concern. Montgomery College has several programs that they are exploring and working towards training more students to work in childcare. But honestly, we have a number of issues outside of the salaries and things like that, because that's always a discussion I think that we're going to have for a few more years. I'm sorry?
No, I was agreeing, a long time.
Yeah. And so we think that right now, because there are so many alternatives and so many other opportunities that may not have been there pre-COVID, a lot of the salaries that childcare staff make are equivalent to the big box retailers, companies, large scale companies. And so it's just kind of difficult. The work that we do is important work and it's challenging work, and you have to have a commitment to children. And so in addition to background checks and all those other things that play a role in our industry, just working with the entities who are training them and getting more people interested in childcare. It's just something that we really are looking at connecting with others, early care and education groups to hear their perspectives, what their priorities are. We're looking at possibly hosting a summit so that we can have kind of a roundtable discussion so that we can share our priorities, but also share some of the challenges and hear some recommendations that maybe we haven't considered as a commission.
All right, thank you so much.
Thank you. Councilmember Lutke.
Thank you. So I have some information and some questions. The first is unique to the things that you raised, Ms. Johnson, which is how do kids report or have somebody to talk to, and I don't want to snitch, but I do want to be heard, and what can I do? The state rolled out the Safe Schools Maryland tip line on October 1st of 2018, so we just celebrated 5 years of having that functional and operational throughout the state. I can tell you from my prior work with that it's very heavily used. It is very useful. Everything from I have concerns about a friend, my friends, their demeanor has changed. I think they're using drugs. I want them to get help. And they have an established system for how to do that. So that's available on the Google Play Store, Apple app. You can do it via phone at 1-833-MDB-SAFE, and you can also submit it through the schoolsafety.maryland.gov website. All the classrooms, or at least most of the classrooms that I have been in within MCPS schools, have a flyer related to this hanging in their classrooms, and the school system also publishes a link to it on each school's website. But based on what you've raised with the children raising that, the youth representatives raising that, it might be time to do another push of reminding people, working with MCPS to push that back out again as a resource that can be used. It is available 24/7, 365 days a year. And it is staffed by live folks. The other piece was generally everybody kind of had data issues or data things that are informing your work, or maybe a barrier to you figuring out, and I know you've raised the issues related to the costs. There is also a lot of analysis that's been done. The data in the system goes back to the 2007-2008 academic year. It is statewide data, so it'll allow you to look at things and drill down comparatively county to county. The website is mldscenter.maryland.gov. There are peer-reviewed published papers in there. There are dashboards that, like I said, you can drill down on. That entity does data analytics. It's the Maryland Longitudinal Data System Center, and they use data from the State Department of Education, the Maryland Higher Education Commission, the Comptroller's Office, the Department of Labor. They have foster care data. And then they have information from the Department of Juvenile Services. One thing I will say about the data from the Department of Juvenile Services is you cannot tell where the referral generated. So you cannot tell whether it was generated from an in-school related incident versus an out-of-school community-based incident. So it doesn't tell you that, but the data in there is de-identified, tokenized, and then matched across those different sectors. So that's how they're able to do that analysis. They do break things out. So some of the demographic pieces, like you mentioned English language learners, they do have that in there. So that is something that you can pull apart as a disaggregated group. They do suppress for small cell size under FERPA, all the acronyms. So anything that's a cell size that's less than 10 will be represented as an asterisk. And that's to maintain data confidentiality. The website? Oh, yeah, it's mldscenter.maryland.gov. And then with respect to the issues related to early childhood workforce, and they do have information on that too, by the way. So that was a long time in getting that together, finding out what credentialing, the certifications, and I know that this was something that was talked about at this year's MACO conference, sort of both the expense and high level of maintaining credentialing for our early child care workforce, to the demands that the blueprint is placing on folks in terms of what credentials are going to qualify for that pre-K, meeting the standards that are set forth in the blueprint. So it may be useful to reach out to the Accountability Implementation Board at the state. They too utilize the data from the entity that I just gave you the website for. The MLDS Center is the data analytics entity that will do whatever the Accountability Implementation Board is requesting be analyzed in order to determine the efficacy of blueprint implementation. So those are my trusted tips for the day. With respect to juvenile justice, I know this is a long-standing battle, slog, however you want to phrase it. And I appreciate what you were mentioning about a juvenile justice center akin to the FJC to make sure that you're pulling together all resources that will serve the kid. Technically, that's what DJS should have been doing, right? We know that's not happening. And I'm well aware of that. And, I expect during this upcoming legislative session a lot of work in this space, because I think at the end of the day, there was a lot of concern from policymakers about why isn't this working? And some things are not legislatively fixed, some are operational, and the operational stuff just wasn't happening, and now it's really not happening. But I don't know if you're following or tracking this, but House Judiciary Chair Clippinger has been hosting a series of meetings related to this topic. They are publicly available, so you can get them off the General Assembly's website and watch, the YouTube stream later. But they are convening folks together, the different stakeholders appropriate to this conversation, in advance of the upcoming session in order to, marshal efforts towards policy corrections and resource changes that need to be made in that space. So I think that would be really helpful for your work. And with that, back to Mr. Chair.
Thank you. Excellent points. Thank you all so much for your continued leadership. We appreciate you. We will next hear from our Commission on People with Disabilities, followed by the Commission on Veteran Affairs, and then we'll round it out with our Community Action Board. And so I know Ms. Galilee is here. Welcome. Thank you so much for joining us and your continued leadership. The floor is now yours.
Thank you. Good morning. Does this work? Can you
Yes,
hear me okay?
Can hear you perfectly.
Now I can hear myself.
It's 9:50 a.m.
Don't understand why that.
The new Good Morning routine.
Excuse me, my phone is like freaking out.
That's okay. Here's a joke to start your morning.
No.
What do you call a bear with no teeth? A gummy bear.
Oh my goodness. What? I don't
Just so you know.
even know what that's about. Apologize for that.
Take your time.
So first, I once again welcome. Good morning. I first want to talk about the fact that we want to recognize the fact that the nation has been celebrating for the past year the 50th anniversary of the 1973 Rehabilitation Act. Mm-hmm. It's something we sort of forget about because we have ADA now, but that was the precursor to ADA. That was the law that helped me get a mainstreamed education in Montgomery County Public Schools. So important to me and in my life, and obviously as a precursor to ADA, very important. We've also been, and thank you for recognizing National Disability Employment Awareness Month, quite a mouthful. We want to make sure that when we talk about employment, that we also think about the fact that you highlighted, rightfully so, our groups that are challenged with intellectual disabilities. But there are certainly people with blindness and all types of neurodiversity challenges, and obviously physical disabilities that are challenged. The unemployment rate is 3 times the national average at about 12%. For people who are employable with a disability. So that's really important to note, right? That it's targeted on that segment of the population. I noted that that number has gone down in terms of unemployment, but we obviously could do better. So we are very focused on that. We heard from Workforce Montgomery last night talking about, and similar to what we just heard about the children's, starting at grade 6 to start looking at ways to educate persons with disabilities on workforce readiness as well as entrepreneurship. And that's something I think our commission needs to look more into for adults as well, in terms of the opportunities. There's a lot more opportunity for people with disabilities to participate in the workforce due to all the technological advances that have been accelerated by COVID. So maybe something good comes from something bad. And so we're looking forward to expanding that. One of the other areas that we're focused on is safe streets for everyone, not just people with disabilities, but all people. This also touches on the Commission on Aging, right? Because at some point of your life, you're probably going to have a disability. Some of you are wearing glasses, right? That's a form of a disability already, right? So we're looking at ways to, we want to really promote the use of putting in more sidewalks and focused on those areas where there aren't any bus routes, to try and get sidewalks put in to serve those communities and really make sure, especially around public schools, that people have access to get to those things. If you're a person who is blind and you don't have a sidewalk, you can't get to a bus, right? Because you can't find your way. So it's very important to do that. The bike, we continue to talk about the design of the bicycle lanes and how they are affecting not only people with disabilities, but just be able to get Metro Access. Metro Access has to be able to drop the lift on a curb. If they can't get to the curb, then you have how far do you have to drive to get? So there's a lot of issues with the bike lanes. And so we continue to work with Montgomery County Department of Transportation on all their various, I think there's like 7 or 8 different projects related to design, and also the city of Rockville even, to look at all of those plans in advance. So if we can get in advance to have our people, our commission look at the different options that are available to help add some input into design, we're very open to that. We even will gather people up and go out and test things if need be. So that's a really big part of what we like to do. Also, another issue is related to the scarcity of personal care attendants. Again, we heard from the Commission on Aging on that issue. That's certainly a major issue. And one of the challenges is that people who have are applying for services, they are over the income level, and that is an issue because you want to make money, you want to have, and whatnot. There's a cost to having a disability. Healthcare doesn't cover all those things, and so be able to equip vehicles, to be able to equip your home, all of those things are substantial costs to people with disabilities and take away from your income. So if you do need to then hire a personal care attendant on top of all of that, you're looking at somebody who's now, might be making a very good salary, but is dedicating most of that income towards care. County, we're really grateful to the county for hearing us last year and to establish the new Intellectual Developmental Disabilities Commission. We are now forging ahead with them to work with them on what does that look like as we work together. We're happy that we have someone who actually sits on both commissions as a voting member, and I think that's a very new and different thing. But it just goes to show that there are needs to have new commissions, but there are needs to also make sure that we all continue to work together. And so a lot of, several of our other points that we turned into you are related to persons with developmental disabilities. There's a need to increase support for more services for transitioning youth, for mental and behavioral health services for younger children, and teens with disabilities, including co-occurring disabilities. And there needs to continue the DDA supplement. The Commission also continues to monitor the implementation of early intervention screening. This is so important to identifying the early diagnosis of autism spectrum disorders in childhood, where they could be just decreased or actually obliterated if there's some work that's done in advance. But naturally, it's difficult for people to address to think about their child that has these needs. But getting these tools out to doctors and making the public aware about early and how important early intervention is important, and really focused on the social economically disadvantaged, there we go, populations in the county. So we request that the county continue funding the funding that was approved last May, and to continue the implementation of these services. The county, we asked that they amend the moderately priced dwelling units to have a percentage to be accessible. The Commission recommends increasing the number of accessible moderately priced dwelling units by requiring 10 to 20% of the new construction of these units to be accessible. Right now, there's no standard that exists. Finally, we are looking forward to recruiting new commissioners, so I want to make sure I say that out loud so that people know that we are looking for people with disabilities, parents with children with disabilities, and providers of services with disabilities, and that will be very soon. We'll be soliciting for that. Thank you.
Thank you. I've got a few follow-up questions. We'll get to that in just a second, though. We'll hear from the other two important groups. Next, we will hear from our Commission on Veteran Affairs and Mr. Miller.
Good morning, everyone. I hope you can hear me.
Yes.
It's truly a pleasure and an honor to be here, and thank you for your service, Mr. Chair. The Commission would like to thank the Council for their over 15 years of funding programs that benefit the quality of life of veterans. And we recommend the following: vouchers for homeless veterans and their families. We commend the county for its Montgomery County Voucher Zero, Veterans Zero 2016 campaign, and in making a priority of the addition of permanent affordable housing for homeless veteran population. With HUD-FASH program and paired with the HUD Housing Choice Vouchers, rental assistance with VA case management and support services for homeless veterans, but not all veterans qualify. The Commission asked the Council to provide subsidies to veterans who do not qualify for VA HUD vouchers. The county has dedicated $650,000 per year for this effort. Also, Serving Together, Montgomery County Department of Health and Human Services provide fundings for Serving Together programs through a behavioral health and crisis services. General funds-based budget contract, contractual services were originally funded in FY11 by the Community Grant Award. We're recommending that the county continue to fund these sources of funding of the estimated $170,000 that provides needed services for veterans and their families. Also, I'm sure most of you know about the Warrior Canine Connection. According to the VA, the PAWS Act, it's an unfunded mandate. Therefore, the Wounded Warrior Canine Connection, pardon me for stuttering, needs help providing these services to veterans, both locally and nationally. The impact of the Warrior Canine Connection on veteran community merits approval of the $50,000 community grant for the county. In addition to these things, the commission will continue to provide suicide prevention awareness and promote resilience by advertising psychic armor and encouraging individuals to enroll in the free training. Also, we're excited about participating in the Operation Green Light activities and celebration for Veterans Day again this year. Also promote social connectiveness for veterans, inclusion in the county activities, enhance economic opportunities and financial literacy and entrepreneurship training for veterans, and work to increase participation of the Iraq and Afghan veterans into service organizations and all the commissions. Thank you, sir, for letting me provide this information.
Thank you,
today.
Mr. Miller, and thank you for your service to our country. And I'm glad to see you're doing well. I know last year you testified only a couple of days after having had shoulder surgery, and you looked like you were in a lot of pain, but testified anyways. But you're looking a lot better now. It's good to see you, sir.
Thank you very much.
We'll have questions for you in just a moment. And last but certainly not least, we will hear from Dr. Jeffrey Johnson from our Community Action Board. Dr. Johnson.
Good morning, County Council members, Dr. Bridgers, and my colleagues on the various boards, committees, and commissions. My name is Dr. Jeffrey Johnson, and I am the chair of the Community Action Board. On behalf of the Community Action Board, thank you for the opportunity to share our priorities with you today. Your support for the Community Action Agency has allowed us to continue its substantial efforts to address community needs. Considered as a best practice, the navigation team you supported last year is now assisting clients facing challenges assessing services. Our board's top two priorities for the year ahead are staffing and returning the Working Families Income Supplement to a 100% match of the state EITC. Our board is incredibly proud of the work that the Community Action Agency is engaged in with its small team. The agency's Volunteer Income Tax Assistance Program, VITA, completed over 1,900 tax returns last year with a total free tax impact of $7 billion. This tax season, without the CARES Act funding the agency relied on last year, our budget for brokers has been drastically reduced. We asked the council to fund 2 broker positions to support the VITA program during the next tax season. The Tacoma East Silver Spring Community Action Center, at the Tacoma East Silver Spring Action Center, the small team of 4 full-time county employees relies heavily on the support of 2 long-term brokers, a contracted opportunity coach, and a contracted navigator. Our board requests the addition of 4 full-time merit positions at TESS. Our board's free advocacy training program for lower-income county residents, the Community Advocacy Institute, now has graduated 126 persons, and we just welcomed 28 new participants. CAI graduates serve on county advisory boards, nonprofit boards, and are engaged in numerous community activities. And I might just add here, just recently, one of our CIA graduates has recently been appointed to the Commission on Aging. We are very proud that the program has been entirely bilingual in English and Spanish since 2021. Our board requests a bilingual part-time broker to support the CAI, communicating with participants, translating workshop written materials, and participant emails. Our second priority is to return the county's Working Families Income Supplement to a 100% match of the state EITC. This spring, 14 other groups and organizations signed our letter to the council requesting full funding for the WFIS. Our board greatly appreciated the council's addition of over $4 million to the WFIS budget in fiscal year 2024. Research links the EITC and child tax credits to other positive impacts, such as increased birth weights, improved maternal health, and decreases in children entering foster care. According to the brand new Montgomery County Self-Sufficiency Standard Report, which is now available on the Community Action Agency website, a family of 3 with 1 adult, 1 preschooler, and 1 school-aged child needs to earn an astonishing $116,864 to cover their expenses without any public or private support. Too many families in our community are nowhere near the self-sufficiency standard. We therefore ask the council to include full funding to return the WFIS to a 100% match of the state EITC in fiscal year 25. As the governing body for Head Start and the Head Start Policy Council, we thank the council for your ongoing support of early care and education and the new coordinating entity, the Children's Opportunity Alliance. We also want you to note that you will soon receive an invitation to a rollout event of our new self-sufficiency standard report. We hope you can join us and learn more about this valuable tool. Again, thank you for the opportunity to share the board's key priorities this morning.
Thank you very much, Dr. Johnson. Thank you, all 3 of you. I'll start with our Commission for People with Disabilities, and Ms. Galilee, thank you so much. I know there has been, understandably, an ongoing frustration expressed by the Commission over the lack of coordination with DOT, over master plans and important policy decisions. I know that there had been some engagement with the Commission as we discussed the pedestrian master plan, which we recently voted on. But I'd just be curious, as from your perspective, how you perceive that coordination going with DOT, and is there more that can and should be done to ensure that further upstream they're engaging with the Commission authentically and the community on this very important topic?
Well, I think that I've seen a lot of improvement and more early intervention, if you will, in terms of coming to us. But I do think it could be better.
Mm-hmm.
I also don't think that enough community sharing has been done on like the bike lanes and things like that, because in some of the public meetings I've been at, a very small number of people participating. A lot of these were happening during COVID, where people were not as engaged as well with these topics. They're not thinking about bike lanes when you're trapped in your house,
Mm-hmm.
right? Now that we're out driving and we're seeing the impact and feeling the impact, now I know that Old Georgetown Road is a state road, but just driving down that road, I noted that you're trying to turn and you can't see the pedestrians who are trying to cross the side street. So you're turning from the main lanes because you've got, literally 10 feet before you can even see them over the barriers and whatnot. So there's a lot of really flaws with the design for safety purposes. And if you're a person like me who's shorter, that's an increased danger as well. So really educating drivers in terms of all these changes that are happening. What is all this green and all these different barriers up, just sometimes trying to find a turning lane through a bike lane and watching traffic, and then trying to realize that I had an incident where a person on a bike was actually going the wrong direction on that side of the street. I wasn't looking that way, and suddenly they were there. So it's, what are the rules for people who are riding bikes too? So all of these issues, I think, are really important. So design as well as education.
I appreciate that. And maybe as a follow-up, I know we had a joint committee session. It was actually public safety and transportation and environment. But I think it would be good to follow up and we may not need a session, but I'd be curious from DOT's perspective, and I know Director Conklin has worked hard on this issue, but finding out who formally is assigned to ensuring that there is better community interaction and feedback, I think would be helpful. And then conversely, at the state level, if there's who the representative is at MDOT and ensuring that we're more direct about doing this moving forward. But thank you. I appreciate that. I'll yield now to colleagues, and then I'll jump back in the queue. But Councilmember Lutke, you're up next.
Thank you. And I wanted to thank you for doing testing, as you mentioned, and your willingness to do that. It's really hard. And I had temporary disability, temporary visible disability, I guess you would say, and that was a 20-month span where I definitely got to test out some things, and it was illuminating in how challenging it is to navigate things if you can't walk. And as you mentioned, the visibility piece as well, because it changes. If I'm used to being 5'7", but now I'm not anymore, you really can't see things in the same way that you once did. And I think it's important to note that a lot of people live with, when you were talking about those who are employable with a disability, of course, which is a subset as a whole of those individuals living with a disability, that we're not always talking about physical or developmental disabilities. Some disabilities are invisible.
Right.
And we need to be incredibly mindful of that. And thank you for suggesting about the amendment for the MPDUs to make sure those types of units are fully accessible. I knew we did have a property open in my district that was a jointly done property with the Housing Opportunities Commission and EYA, the Laureate in Darewood, and that was one of the first things I noticed. They have all of them have zero entry showers. All of them, like, it was built so that you wouldn't have to convert or change it later. And built with that in mind, it's much easier to do it from the get-go. To have everything meet that standard as opposed to trying to retrofit something later. So I think that that is a really important thing that we should stay and keep focused on for everyone. So thank you for that. I wanted to know, were there particular nonprofits here in the county that you're working with related to supporting for transitioning youth into workforce development kinds of opportunities? Because I'm familiar with one in Anne Arundel County, Opportunity Builders, Inc., that does some really cool and amazing work, but I just wanted to get your thoughts about that.
We certainly have a number that sit on the commission,
right,
that are active members and contribute to making us aware of the issues and challenges, and that's where that's why we bring these points forward. So yes, we're definitely working with them.
And I know I dear friend of Jen Lynn with Up County Community Resource Partners. So I know there are entities that exist, but there's definitely gaps or things that could be done better. And from the folks you do have on your board, what would you say are the prime examples of what we could be doing better to help our transitioning youth?
Well, the biggest challenges are, there's a lot of retirements and whatnot going on where we have gaps in services because there just aren't enough people.
Right.
The wait
Okay.
lists are very, very long, and so that's probably the biggest challenge, is just dealing with the fact that there's just this line going way out there, and it gets longer and longer. And a lot of people come to this county looking to get services, and that only makes it even more challenging. So I think that's probably the biggest thing. That's is just try, and also, we have state funding and county funding and all of that, and just some navigating all of that, and educating, especially the parents, early thinking about transitioning. I like the fact where they talked about, starting at grade 6, right? Thinking about the future.
Right.
Of course, I'm not sure at 12 years old I would be thinking about what I want to do.
I was going to say my 12-year-old definitely isn't.
Right. But the parents have to think that way, right? You have to think that way, because that's where you're building that self-sufficiency, right? That's when kids start to really blossom and become self-sufficient. And that's the important thing, is to really start thinking about, okay, well, is college going to be possible for this person?
Right.
If not, what are they going to do all day? What are the resources that need, especially in the developmentally disabled community, now that person doesn't have that enrichment every day, what's going to happen?
Right.
So really coming up with a plan is critical.
And do you think I know one of the things that I've heard in the community, especially with transitioning aged children, is that they may have had an IEP in K-12, but IEPs don't exist for higher ed.
Absolutely.
Right. And that's
but
it.
there are many colleges and universities, and Montgomery
Right.
College is a great, I know because my niece worked there, worked at there's always, many colleges and universities have a disabled student services.
Yes.
And so they can now do a lot more intervention, and I think there's a lot more, because my nephew has diabetes, and we often don't think of that as a disability, but he can't take a test if he's high or if he's low.
Right.
So he's got to have something in place, and Montgomery College
Yep.
has, assisted him to really help to make sure that he's got what he needs. So
Yep.
I think it's also, again, if you don't know to reach out to those
Right.
services, then, even if they say no, right, at least you've made that effort.
Right, because they should, they have the ADA to protect them. If you're saying this is an accommodation that I need, it's just you're coming at it from a different direction. And I think that that's another sort of, for caregivers, parents, families, teeing up, as you mentioned, well in advance. This is the type of shift we're going to need to do. So thank you for surfacing that.
Yeah, my awareness about juvenile diabetes is certainly something that I don't think we focus enough on
Yeah, agreed.
as well.
Thank you.
Thank you, Councilmember Lukey, and thank you everyone for being here. Just going to start with Ms. Galley, since you are at the top of my list. Thank you so much for your very informative updates. I did have a question, since Councilmember Lukey asked about our youth. Just wanted to know how we're assessing the programs for our youth with developmental disabilities. I know that Councilmember Lukey mentioned a few. Are there any other ways that we can support you with accessing any other programs? Any particular areas?
So most of our focus is on that transitioning youth, because a lot of this work is done through Montgomery County Public Schools. So and they have focused on that. So we focus primarily on
Afterward.
that transition.
Perfect. Good. And then I know you mentioned some partnership engagement with the state level. Are you aware of any efforts to address the wait list in the state that we can help you advocate for?
Well, certainly that's one of the major issues that is transitioning for advocacy through the new Commission on Intellectual Development Disabilities. One of the reasons why that commission was established was to allow them to have more contact with the state. Our charter doesn't allow that direct access to the state, so this new commission will be addressing that issue head on, and we'll be certainly supporting them.
Good, good. Please let us know how we can be helpful. And then I saw the number, 30,000 individuals waiting for home care on Maryland's DDA waiting list. Do we know how many of those residents reside in Montgomery County?
I don't have those figures.
Okay. Ms. Yao, thank you. Okay. And Mr. Miller.
Yes.
Yes, thank you so much for your continued leadership in Montgomery County on the Veterans Affairs Board. I know that a former council member, George Leventhal, worked to end veteran homelessness. What do we know about the current state of homeless veterans in our county? Do we know if there are any in existence currently? How are we tracking that information?
I don't have the exact numbers right now. We just had our meeting on that, and
Oh, good. Okay.
I can get those numbers.
No, Ms. Yao will follow up to get that information to us. Just want to make sure that we are connecting this body with the resources with HOC and any other opportunities to make sure that they know what resources exist, from MPDUs to any other supportive services, that wraparound services they may need access to. All right. Thank you so much, Mr. Miller, for being here. Mr. Johnson, thank you so much. Always a pleasure to see the Community Action Agency here and the continued advocacy on behalf of our underserved and impoverished residents in Montgomery County. I know that the Test Center has been so instrumental in helping new residents acclimate to Montgomery County and access services. And I was disheartened to see that there are continued funding needs. I know that there's been an increase in services and clients at the center, and shortages all around for social services. And as we heard in early childhood education careers as well. What are we doing to recruit new folks to the test center employment-wise? Because I know that there's a need for more staff with a diversity of experiences and expertise.
Well, you have my full testimony, but you know what we have now are 2 full-time people, and we have 2 contractors, and you know the contracting people are doing the same work as the folks who are our merit, and what we want is for merit, all of them be merit, and we think that will enable us to meet the need at this time. But that's what our request is, and we think that that'll again help us do the fine work that the test center is doing.
I know that the CAB has been instrumental in the VITA program,
Yes.
Volunteer Income Tax Preparation Program, and I see that federal funding is at risk, or it's not coming. It's confirmed that it's not available for the upcoming tax season.
Well, in the past, we had a United
Grant.
Way funded position, and those funds were taken away. As you can see, 1,900 folks being served, that takes a lot of, hands-on. And so during the tax season, we just need the ability to have more hands on deck because we see that number increasing.
Okay, so is there funding for the upcoming tax season for the volunteers, tax preparers? Or-
I think it is. I have a
Leah?
staff person here who can be more specific, Leah.
Come on up, Leah. Yes. Of course, you're always welcome, Ms. Goldstein.
We do have funding.
Okay.
The issue is that we had some CARES Act funding that helped
Yeah.
support us during the last
Okay.
tax season, and that funding is no longer
Gone.
available. We've used up all of the funds, so we are requesting our board is requesting some additional support to fund some part-time brokers during the very busy tax season.
Okay, are you still training the tax preparers? You're still doing the training
yeah.
as well?
Absolutely.
Okay, and have you reached out to the Montgomery College? Are they helpful with identifying folks?
Yeah, Yeah, one of my colleagues has a very close relationship with Montgomery College. He goes and speaks to the accounting classes there and
Yes.
encourages people to volunteer. So
Okay, good.
very actively engaged with Montgomery College.
Good, and I believe USG also has an accounting program as well, so we could find some additional talent there. Okay, all right, that's all I have. Thank you, everyone.
Thank you all so much. So, Mr. Miller, thanks again for your service. And I just want to give a shout out. So during the crisis that we had in COVID when we were lacking bus drivers, I read an article where a number of our veterans stepped forward, retired veterans, to become bus drivers and saw it as sort of a service, continued service to our country. It just, that particular article just really struck me, and how our veterans continue to serve in our community in so many different ways. So not today, but would love to follow up and get an update on how the preference is going for our veterans and whether that has made an impact on our hiring opportunities here within county government. Dr. Bridgers is a veteran and served our country ably and continues to. So I would love to get an update on that. And conversely, we also have a hiring preference in our disability community as well. And so would love to get an update on how that program is going and whether it needs to be tweaked or reevaluated. And I appreciate the recommendation for the full-time physicians. I have visited the VITA program numerous times. I've seen it firsthand. I've spoken to the participants that benefited from the program. It's done in a culturally competent manner. It's done with tremendous patience and care. It's really extraordinary. And so it is a program that I think it's both in the county and the state's best interest to support, because it encourages people, particularly who are in the rears, to come forward and pay their taxes in the first place. And as we know, there are many people who, for a variety of very understandable reasons, are reluctant to come forward. So we should do a cost-benefit analysis on that. And I think what we'll find is the program more than pays for itself. And maybe we can even go deeper to find those folks who are even further in the rears to help get them to come forward and come up with a suitable and responsible plan to help them pay their back taxes. So thank you all very much for your continued leadership. That is it for this particular panel. So you all did a fabulous job. And we will not be hearing today from our Intellectual and Developmental Disability Commission because they have not yet met. They had their first retreat to prepare for their first meeting, but I am going to read an update regarding their important work. And I especially appreciate Ms. Galilee's comments about the cooperation and partnership, because the two incredible commissions must coexist and work collaboratively together to help uplift our community in so many ways. But the IDDC will hold its inaugural meeting on Wednesday, October 18th at 11:55 a.m. The meeting will introduce the commission's newly elected officers, including Chair Dr. Michael Greenberg, Vice Chair John Whittle, and Secretary Jake Didinsky. And a significant item on the agenda for the first meeting is the review of Montgomery County Council Bill 3323, which pertains to the establishment of a volunteer registration system for emergency 911 calls. I really want to thank Councilmember Lutke for her leadership on that issue. We had some very compelling testimony, and this is an opportunity for the commission to help guide us and advise us from their perspective, which I think will be terrific. Commissioners will have the opportunity to participate in a Q&A to retrieve more information regarding the bill and its possible impact. And during this meeting, the Commission will also discuss the frequency of future meetings, subcommittee structures, protocols, and the initiation of discussions regarding the Commission's priorities. I should note for the public, all boards and commissions are open to the public. You may either tune in virtually or come in person. And most of the boards and commissions are now hosting their meetings either through hybrid fashion or exclusively virtually, which has really opened up a lot of possibilities for people to participate, which is a good thing. So With that, I want to conclude by once again thanking you, Ms. Yao. There's some follow-up that we will work on, and I want to thank also Ms. Tenenbaum and our IT staff for helping to facilitate the last 2 days' worth of sessions. With that, we are adjourned. Thank you, everyone.
I mean, it's part of the experience, so good for that.
We don't have such a big cities around us, so it's cool to come here and be able to go to DC